Welcome to the Deep Dive. Today we're focusing on something really fundamental for long-term health, understanding diabetes blood testing. Our mission, really, is to give you the info you need to, well, manage your health proactively. And we're using local resources as a guide here, specifically looking at info like you'd find on Blood Test UK.
Right.
So let's start simple, like really simple. A diabetes blood test, at its heart, just measures the sugar, the glucose in your blood.
Exactly. But don't let the simplicity fool you. It's a powerful tool.
Right. It's not just a checkup number. It's about stopping serious problems before they even get a chance to start.
That really is the core benefit, isn't it? Knowing your numbers. Regular testing isn't just data collection, it's active prevention. It lets you, or rather, your doctor, intervene early. We're talking about preventing really major complications here, things like heart disease, kidney failure, even nerve damage.
Neuropathy, right? That painful side effect you hear about?
Precisely, and regular testing helps head that off.
So these test results, they become like a roadmap for your health plan.
Absolutely. They give your healthcare provider the solid data they need to make smart adjustments. Maybe it's tweaking your diet, maybe recommending more activity, or perhaps adjusting medication like insulin doses if needed. It allows for that tailored approach.
Okay, so how do we get that data? What are the main tests we should know about?
Well, there are a couple of key ones. First, there's the fasting test. Pretty straightforward, measures your blood sugar after you haven't eaten overnight. Gives a baseline.
A snapshot in time.
Kind of, yeah. But then there's the A1C test. This one's different. It shows your average blood sugar level over the last 2 to 3 months.
Ah, okay, so that's the long-term picture, the trend.
Exactly. It gives that broader view of how things have been going overall.
That makes sense. But, quick question, if the A1C gives you that whole movie, why still do the fasting test? Why bother with the snapshot?
Good question. The fasting test can catch more immediate, sort of acute situations, a high reading right now. But the A1C is strategically vital. It smooths out the day-to-day ups and downs. You can't, let's say, cram for an A1C test by eating well just the day before.
Ah, I see. It reveals the real, sustained pattern, no hiding.
Pretty much, yeah. It shows the truth about long-term management.
Okay, that clarifies the why and the what's clinically. Now let's make it practical. Let's talk local. Using that Blood Test UK guide as a reference point, where can listeners, say, in the Bicester area, actually get these tests done? Looks like there are quite a few options, which is great for local access. You got the Bicester Health Center, obviously John Radcliffe Hospital is a major hub, and the Village Surgery, too.
And don't forget pharmacies.
Right. Local Boots pharmacies often do simpler blood glucose monitoring checks as well. Good point. And what about the practical side cost, booking?
Generally, if your GP refers you for a test on the NHS, it's usually free. Private tests, if you go that route, they typically range from, say, £30 up to maybe £100, depending on the specifics.
And booking is usually just through the GP or sometimes online systems these days.
Yeah, pretty straightforward usually.
Now, preparation. You mentioned fasting for the fasting test. That seems key for accuracy.
Absolutely crucial. Usually it's an 8 to 12 hour fast. No food, just water is okay.
That can be tricky for some people. Any tips?
Best tip, schedule it first thing in the morning. You fast while you sleep, wake up, go get the test done. Easiest way to manage it. Avoids temptation.
Makes sense. Get it done before breakfast hits.
Exactly. Also good to avoid heavy exercise or alcohol right before, as that can sometimes affect results too.
Okay, so you've had the test.
Yeah.
Now what? How do you make sense of the results? You mentioned the A1C benchmarks earlier.
Right, the A1C gives a good general guide. Typically, a result below 5.7% is considered normal range. Once you get to 6.5% or higher, that's generally the level indicating diabetes.
But those are just general markers, right?
Absolutely. It's so important to stress you need to talk to your doctor or healthcare professional. They interpret your results in the context of your health. No one-size-fits-all answer here.
Got it. Always consult the professionals.
Always. And regardless of the result, whether it's normal, pre-diabetic, or indicates diabetes, the next steps often involve similar foundations. It's about building and maintaining healthier habits, a balanced diet, regular physical activity.
How much activity are we talking?
The general aim is about 150 minutes of moderate intensity exercise per week. Brisk walking, cycling, that sort of thing.
Okay. And the testing itself helps keep you on track.
It really does. Think of it as a feedback loop. Regular testing encourages those better choices because you can see the impact your efforts are having and motivates you.
So to wrap up our deep dive today, we've looked at what diabetes blood tests are, why they're so strategically important for preventing big problems, and crucially, where you can access them locally. using Bicester as an example and referencing resources like the Guide on Blood Test UK, making it actionable.
Exactly. It's about empowering you with that knowledge. And that leads to a final thought, something for you to consider. If regular testing helps spot these patterns, guiding treatment and preventing future issues, it raises this question: how much more valuable is knowing the trend of your results over time compared to just knowing a single number from one specific day? Really thinking about that trend that's moving from just reacting to your health towards truly mastering it.